Thanks so much for having me today. It's really nice to get some do a pitch, get some feedback on it. I'm going to tell you about NeuroReserve, the company I founded. Before I get into that, I'll tell a little bit about myself. This is a deck that I provided to Startup NB a couple of days ago, or was it yesterday? It was yesterday. Yes. So I won't be hitting all the slides, but I'll be hitting some of them. And this first one here is about myself. So my background is in biopharmaceuticals and medical devices, and I'd say probably the most important thing about me to know is that I have a family history in neurodegenerative diseases. So my father had Parkinson's disease. He was diagnosed very for that at the age of 48. For many, that's early. And that had a huge impact on my family. At some point, we get to a point in life where we ask ourselves, well, we got the skill set, or at least have part of it. So why don't we do anything about it? And there's a big gap in the nutrition space for brain health, and that's what drove the creation of NeuroReserve. So here's the big picture. If there's any disease out there or disease states like in neurodegenerative diseases are ones that could potentially just bankrupt Medicare. We've gotten really good at handling cardiovascular disease, diabetes, even cancer. But one area that just hasn't made much progress is neurodegenerative diseases, Alzheimer's and Parkinson's being the two largest. And what we're looking at here and what the medical and scientific community has realized over the past 5 to 10 years is that the pharmaceutical solutions won't be the silver bullet. These diseases start far earlier, and prevention really needs to be an area of focus, and in particular, nutrition. And that's making its way into the public consciousness. Now, the thing is that here's a problem. If people begin to understand it can affect their trajectory of their brain health, then they would obviously start looking for brain nutritional supplement or nutritional products. And a lot of people do, but there's a substantial portion of people who, although they have the intent to buy, they just don't do it. And they're essentially, obviously a little skeptical. So it's a new area. It's an immature field, and there's a lot of confusion in the space. Now, if you take a person who's looking for a nutritional supplement for brain health, they're looking at they got their physicians, like primary care, maybe neurologists. They ask them, what should I do about nutrition for my brain? And those physicians don't get taught much about nutrition anyway. So they kind of say, I'm not sure, I don't know, right? On the other hand, they look at the marketplace and they see all these products out there and they go, wow, all of them have a solution. All of them say they're the one. You can see where the dissonance takes place, right? And, our customer, the one we're shooting for, is realistic. And when we asked them, in a survey, so what would make you more likely to purchase then? The number one answer was, we just want you to collaborate with leading researchers, from like leading institutions. And I think they're wise to the fact that, it's not easy to run, kind of like a 10, 20-year study for prevention, but they do know that there's enough points out there that if you connect them and connect those dots and you have the right people do it, you can come up with some pretty neat solutions. And so that's what leads to the concept or the model of NeuroReserve. And the whole crux of it is these three components. The first is, let's take the entire breadth and depth of what we know in brain nutrition, from research studies, from academia. And that's a lot of data. So we need to be able to assess that data. But it doesn't mean anything, and it can't be integrated into anything meaningful unless we have the right experts to interpret it. And so that leads to those leading integrated expertise, that circle in the upper right. And so that right there is the core kind of three major components of what we would imagine to be a new kind of generation of nutritional supplement companies for brain health. And so, one of the main cruxes of that is the team. I mean, really, it really starts with who is, what kind of experts can we bring together that care about nutrition are, leading neurologists, leading researchers in nutrition. And so there's only a couple things I want to say about this. The first is that we're building upon an asset here in Nevada. It's the Cleveland Clinic's Clinical Center for Excellence in Brain Health. So it's called the Lou Ruvo Center for Brain Health. It's in Las Vegas area where NeuroReserve is based. And the second thing is that there isn't any other nutritional supplement company focused on brain health that could boast this sort of a team, when we include also the industrial advisors we have as well. And so I'm really proud of this team. We worked hard to develop our first product. And so I'll tell you a little bit about our first product. We have to launch with the first product. It has to be our anchor product, if you will. And that anchor product we're calling Relevate. We're launching it this summer. And in a nutshell, what it is when we look at the strongest data and evidence out there, and we look at that data and evidence around the people who have the youngest brains, who are also happen to be older people, we find out that there are certain dietary patterns that they fall into, and they're typically a modification of the Mediterranean diet. And so then we looked at the population level, at what typical nutrient intakes are there at the population level here, at least in a North American or kind of a US diet. And then we plug those gaps, we fill those gaps. And that's what the product is. Now we've done some forecasting. Obviously we need to look at the market, look at what sales potential is, and build a bottoms up sales forecast. And about 3 years from now, where we'd like to be is at about $50 million in sales and growing from there. And there's a couple channels that we can achieve this through. And the first channel is online. So we intend to launch online first through our own website. And but we know, that at some point there's going to be a point of diminishing returns as far as marketing efficiency. And we're going to need to look at other channels as well. And so that's where this kind of phase 2 comes into play on this slide here. And that's where we start to move into other channels, whether or not they be online or other retailers. And, I just want to kind of close with this kind of vision slide, and that is, where we want to be is one day running and being a part of or advancing clinical studies. At the end of the day, the ultimate thing that we can do is run clinical studies, 10 years long-term clinical studies, be involved in that, that can really elucidate whether or not our products with use in a subset of our population, can, without a doubt, right, reduce the likelihood of neurodegenerative disease, or delay or prevent it altogether. And the way we do that is over time, right? Start with specialized products first that we build off of human data, but in observational and cohort studies. And then we work with research collaborations, and we love to send in an NIH grant and work and to understand and connect how people and our customers behave as far as their eating habits, as far as their lifestyle habits, and connect that with higher resolution databases that are, with the Michael J. Fox Foundation or the NIH or Alzheimer's Association, and then be able to predict things out of it, make predictive models that can help us design great products and design great studies. And that's where we would like to go in the long run. And that's defendable. And so, I'm going to end here with the investment. It's kind of laid out here on the left-hand side. We're building this company from ground up so that it could be a target for the consumer health division of a pharmaceutical company, consumer health companies, or consumer packaged goods consumer health divisions. That's really where we want to be. And there's a couple reasons why you would want to invest here, bulleted out. But I know that there's a lot of people here who are very interested in the economy of Nevada. And so we are based here. And that's something I wanted to make sure is clear. And also, really, the people who would really care the most, are people who have actually had someone they care deeply about affected by either Alzheimer's or Parkinson's disease, or other neurodegenerative disease, such as like ALS, for instance. And And so I know that, you know, if you really care about that, you're waiting for that opportunity to get involved. This is it. Take it. So I'd like to end with that. And thank you so much for your attention, and love to answer questions.
Yeah, I think everybody, mostly, well, everybody on the board knows Startup NV, and you know, we're an incubator for scalable startups in Nevada. We have a couple other programs to let you know about. One is Fund NV. That's our early stage pre-seed fund for member companies who have been with us for at least 90 days. You can apply whenever we run an investment cycle. Our application window for our June investment cycle just closed last night. We have 8 companies that have applied. 2 will be selected to pitch on June the 2nd, and then one of those companies, unless something really strange happens, one of those companies will get an investment of up to $50,000, which we hope to syndicate into more money, but that will depend on the company and the excitement around the investment. And then finally, we are doing an angel investor and education conference this fall and winter called Angel NV. It's the first part of it in the fall is for founders. We're calling it a Founder Academy or an accelerator program that runs September 8th through December 8th. And then following that, immediately after CES in Las Vegas, we're going to do an Angel Academy where we're going to be teaching 20 to 40 angels how to be effective angel investors. That conference is going to start immediately after CES and run through March 25th. And that group of new angels will invest $200,000 in one of the companies that goes through the Founder Academy. So if you are a founder and interested in attending the Founder Academy, you can find the application or the registration form online at angelnv.com. If you are an investor, an angel, and maybe never got the full download on how to be effective at doing that, we're going to be spending about 10 weeks, once a week, going through all of the things you need to know how to be an effective angel. And at the end of that, you, along with the other accredited investors in the class, will have an opportunity to make an investment in one of the companies that went through the Founder Academy. And there will also be other companies applying who did not go through the Founder Academy. So whether you're interested in learning more about being an angel or a founder wanting to go through the Founder Academy, please check it out at angelnv.com.